Awareness Month. 1 in 8 women will be diagnosed with the disease in their lifetime, but when it's caught early, before spreading beyond the breast, it has a 99% survival rate. Our experts agree that screening is your best defense. That means clinical breast exams and, after age 40, annual mammography. But for some women, like Cheryl Bilchin, that's not enough.
With dense breasts, you have a lot of lumps and a lot of cysts, and on the mammogram it was clear, but on a sonogram they found 2 that were a little bit larger, 2 what they thought were cysts. So they did a needle aspiration and found that there were some cancer cells. So then we did a bigger type of biopsy. They call it a core biopsy, and that definitely was positive for cancer, but I was very fortunate. They were very, very small. It was very, very early. I remember Dr. Gingrich saying, "Now this is the diagnosis, but we're not leaving you alone. You know, you're not alone, and we're going to be with you all the way." And they have what I call patient advocates, and mine is a nurse, Tennille, who would schedule appointments. I could call her at any time. My husband even called her because he had a couple questions.
Those breast health navigators are very important. Dr. Gingrich and Dr. Joseph back with us. Thanks for being our guests. Thanks to OSF St. Francis for sponsoring tonight's Docs on Call. And Cheryl brought up a couple of important things. She talked about the breast health navigators and how important they are in terms of your quality of care and helping to answer all those questions, even what may seem like a silly question to a patient. You know, to have somebody that can help out is so important. Beyond that, she talked a lot about dense breast tissue and what makes that maybe a little bit more difficult for a mammogram to see clearly. Can you explain a little bit more about that and when you need to do something more?
Right. So as a radiologist, we classify the breast tissue into different densities, and various women can have different ratios of fatty tissue and what's called fibroglandular tissue. And the more fibroglandular tissue you have, the denser it is, so it makes it harder to see through the tissue on the mammogram. And sometimes patients will then come in with maybe a lump that they feel, and it may not show up on the mammogram, and we use ultrasound. So there are other tools that we use with mammography, and there's been a lot of studies looking at the utility of doing kind of a full bilateral breast ultrasound of both breasts with mammography to see if more cancers can be found, and it's holding true.
Now, a sonogram is not necessarily better than a mammogram, right?
That is correct. It does not replace the mammogram. The mammogram is still the gold standard, but this can be used with mammography. There are certain cancers that won't be seen on the ultrasound, and we have to rely on the mammogram. So really it's using both tools together.
Very good. And I told you off camera too, I had recently been talking to an older breast cancer survivor who had a lumpectomy several years ago, but now at 81 she still gets her mammograms. Good for her, right? But she was confused by that thought of her doctors recommending that she also get a sonogram. Even at 81, you say this is very good.
You know, there's going to be different situations where that doctor may want her to have an ultrasound. It may be that he's read on her report that she has dense tissue and he's just wanting another look at the tissue in a different way. Or there maybe was something that was felt or something that was seen on the mammogram, and the ultrasound is used to further look at those areas.
All right. Let's take another question, shall we? Louise is on the line. Thanks for watching Docs on Call. What's on your mind?
Yes, I had a hysterectomy, and that was when I have a discharge, and I wonder where it come from. It's not real heavy, it's just light. I may have a discharge like maybe today, and maybe I won't have another till maybe next week or week after next. I just wonder, you know, what could cause of it.
How long ago did you have the hysterectomy, Louise?
In 71.
So many years ago.
Right.
And you're still noticing spotting?
Yeah.
Okay.
Okay. Well, you know, discharges can come in different forms. One, it could be mucousy. Another form is bloody. And yet, so it can mean different things. The vagina itself, produces lubricant to keep itself moist. So there's that. But more concerning is, discharge that has any kind of blood or any kind of other changes in it. Even though you've had a hysterectomy, there's still a very small chance of cancer, and there's also chances of infection and that kind of thing. So again, I would recommend mentioning it to your primary care provider and getting it checked out.
Okay, all right. Tanya has a question for you now. Thanks for watching, Tanya. Go ahead.
Yes, I recently was diagnosed with atypical hyperplasia, and I was wondering, they said that I should go to the doctor every 6 months for a mammogram, but my insurance will only cover once a year. Is it all right that I just go once a year?
Very good question, Tanya.
So atypical ductal hyperplasia is a kind of pre-cancer cells, and if it is diagnosed with a needle-type biopsy, the recommendation is to have that area removed. Generally, then the surgeon sets the guidelines for how often that patient needs to return. It's not uncommon to return initially in a 6-month follow-up, but sometimes there's other things that are being followed on the mammogram, and many times that is what's leading that follow-up. So it is a recommendation to continue with the follow-ups until the surgeon or the radiologist clears the mammogram, clears the tissue problem.
Right, even if the insurance doesn't cover it.
Well, it is our recommendation. I can't, we follow close guidelines because there's studies that support why those recommendations are made. And so we have to be, very objective when we're trying to analyze the tissue and follow those guidelines, and it's for one's benefit to make sure that things are taken care of and are followed accordingly.
Tanya, good question. Bottom line sounds like follow doctor's advice and get that mammogram when they say you need to get it. And maybe talk to a breast health navigator, seek some assistance if there is some assistance out there to pay for it.
Exactly. There are different programs, and you can just see if you qualify for that program. You can start by talking to your own doctor, and then you can always call out to the breast center and ask for one of the nurse navigators and see if they can get you some directions. So
and that's why folks like us with organizations like Susan G. Komen or the American Cancer Society talk about the need for funding for grants that help women in these situations for screenings. Let's go now to Beverly, who's on the line. Thanks for watching Docs on Call. What's your question?
My question, my mother had cancer probably 34 years ago, radical mastectomy, and then 10 years later it went through her whole system. I'm very inactive. I live with chronic pain, and I've got a lot of fat underneath the breast, my stomach, and my hips. So I was wondering, when I found out that fat has a lot of estrogen in it, am I more at risk with it down there?
Good questions, Beverly.
Yeah. With the fatty tissue, you do release more estrogen, so it has been proven that it does put you at an increased risk. Ideally, you want to try to be somewhat active, although it sounds like it might be difficult for you. Trying to eat healthy, doing whatever you can to try to improve your diet. I don't know if you wanted to add anything to that, Dr. Joseph.
Yeah, absolutely. I agree. The things that you can do, most importantly, first and foremost, is your diet. As you mentioned, the things you put into your body. Keeping it in this country, we tend to do a lot of heavy carbs, pastas, breads, that kind of stuff. So limiting that and